Hello.
Hi Vidya, how
Hi.
are you?
I'm good, Pooja. How are you? Can you hear
I'm
me
doing very
clearly?
well.
Is my video
Yes,
clear? Okay,
yes,
great.
loud and
Because I
clear.
thought, awesome. Because I thought there was some kind of a connection difference when I put on your live.
Yeah, I think even I had a little bit of internet issue, but now it's all sorted. Looks like it's all
Oh, great.
sorted.
Yeah,
Yeah,
and
we'll
I
we'll
think
see
we're
as it
kind of
goes.
used to it. Yeah, I think we're used to the lag
Sure.
now. We're all gonna
Yeah,
be, so that's all right. Oh, great. I think
yeah,
we'll wait for a few while, then we can start.
sure,
How have you been?
sure, Vidya. I've been really good. So wait, I want to
Good.
introduce you before we all start
Sure.
now. So,
All right.
so as I already told everybody, I think I've spoken a lot about you already, even in the morning live and
Okay.
even before.
Yeah,
Most,
I
at
see.
least people who have been talking about health and wellness week are mostly looking forward to your session because that's something which people don't talk much about.
Absolutely.
And I think most the people who have even responded to all the ads and all the promotions have been just I just want to thank you so much.
Lost you.
Really busy. Thank you for taking out the time to talk to us and to even help us understand why it's
Oh,
important.
this is my
So
pleasure.
let me
It's my
let me just
pleasure.
introduce you.
Sure. Eh,
Sure. So, Dr. Vidya, I've been talking to Dr. Vidya since about 2 weeks, and I've only been every time I look at her or I talk to her, even on text, I always smile at the end of it because of the way she types, because of the aura she has around her. Even now, I think
Right.
everybody can just see how this smile doesn't fade off, and I think that's one really good thing that we should take away from this session today. Whatever happens, smile for a while. So,
Absolutely.
Vidya, I want you to talk about yourself for a while on where did you study, where did you grow up, how was your childhood like?
Yes. Actually, I'm losing you in between, so there is a kind of a disconnect. But yes. So yes, talking about me, as a child, I've always wanted to be a doctor. So I went for that dream. I became a doctor, and then post my MBBS, I started working in a hospital. So I was always in intensive care, like new. Uh, have I lost you? Can you hear me? Are you online? I think I lost you in between again. Am I audible or am I disconnecting in between?
It's
Okay.
a little
Damn. Yeah. Yeah. It's really bad here. Let me just do something about that. Put my-
you can't hear me. Okay, let me also figure out. Give me 1 second. I'll just figure out my internet for one second. Vidya, just give me 1 second.
Sure.
I think even my internet's lagging. Give me just one
Yes,
second.
there's quite a lot of that. Yes, yes, sure,
Sure,
no problem.
just 1 second. Till then, you guys can
Yes,
see my
yes,
books
absolutely.
for like a minute.
Can't hear Pooja though. Okay, I guess then Pooja's connection is not good because I thought it was mine. Great.
I think this should make it better.
Yeah.
I
As
closed a
as
lot
long
of
as we're
doors here.
audible, it's still fine. Yeah, great.
Yeah, I think it's better now.
Yes, it's better. It is better. I can see
Guys,
you clearly now.
if you can hear both of us clearly, just let us know so that we don't miss out on some important things that Vidya says.
Yeah. Right. I think, yeah, because I think someone mentioned that they could hear me but not hear you. So there was a lag between your network and mine, and I thought it was mine. Yes. Okay, I think Pooja's network is still
Now
all right.
they can hear.
I'm just gonna start off. Okay, we can hear you guys. I'm just gonna start out, anyways.
Yeah.
So yes, I'm a doctor, and as I was saying, as working as a doctor, I saw a lot of patients who had with just their mental willpower, and I've seen miracles happen, for instance, and I have seen incidents where stressful environments in certain households, in certain situations, have led to serious illnesses. So that had led me to, look more into it. I actually realized the power of the mind at that moment, and I started doing my own research. Always had an interest in psychology, so I started doing a course in that. I started my research in neurosciences, because everyone believes science. Psychology they might not, but if I give science behind it, they will believe it. So that's how I work around things. Yes, because and being a doctor, I can explain those things in scientific and valid forms, so people will buy it. And if someone gives you a philosophy, they will be like, "Oh, it's just a philosophy." But if I tell you the science behind it, you will believe, yes, this is true, right? So that's how I worked around this whole concept of mental health and how it controls our body and how our mind is so essential. I mean, it's as simple as we know this, that the mind controls our body.
Hmm.
If our mind is
Yes.
not healthy, your body cannot be healthy. It's as simple as that. It's just as simple as that. But then it's so neglected. It's so underrated because of the stigma behind it. And people are so hesitant in talking about their issues. People are so hesitant to, to go and ask for help. And it's sad because, there's so many of us who are going through issues but are not aware of it. And even if they are, just because of the shame associated with it and the fear of being ostracized, they are fearful of that. People think that if I talk about me being not okay, people will look at me weirdly and people will think I have some kind of a mental problem. And a mental problem is look like something really weird and devastating. Whereas it's normal, it's a normal thing. If your body can have an issue, so can your mind. So yeah, and that's what I want to do. That's what I strive to do, to normalize our mental health issues. Just like you would not shame anyone with a heart attack or a kidney stone. You shouldn't shame anyone with any kind of mental health issue, like be it anxiety, be it depression. It's an issue. It's a health problem. So it should be looked at the same way. So yes,
Correct.
that's how I also started. Yes.
That's a very nice spin, I must say. And I think I just want to commend you on this, that I think your voice is so soothing that I want to hear what you're talking.
Oh,
So
thank you
that's
so
that's
much.
one compliment. Yeah, I'm starting it right off
Thank you,
because
thank
I've
you
seen
so
most of
much.
your videos, and even my team has gone through a lot of your videos, and
Oh,
that's the comment and the compliment they came back with, saying, "I want to listen to Dr. Vidya because of the way she talks."
uh, thank
So
you so much. I only recently started making those videos though, because now I'm at home and I have the time. Otherwise, I've always had it in mind to do them, but never got the time to. So I'm such a great feedback. It makes me do more of it now.
yes, definitely, definitely. See, we
Thank
are
you.
already getting comments saying, "Great voice, very impactful."
Oh yes, thank you so much. Thank you, thank you so much.
So let's dive into a few questions here, Vidya.
Absolutely,
So,
yes.
so how was it growing up? So, have you always been Dr. Good Vibes?
Well, yeah, it was very easy for me to choose the name because, yes, I'm always like this. I mean, in fact, during my college time, I had one of my colleagues, like I hardly knew her, but she used to see me around college in the batch. So one time she just came up to me and asked me, it's like, every time I look at you, you're always laughing and smiling. Like, how are you always laughing and smiling? And I'm like, is that a problem? Like, that's what I responded to her. I'm like, what is wrong with that? So she's like, no, it's a great thing, but I've always seen you that way. And if you ask my
Correct.
friends, one thing they can never forget is my laugh. Like they always talk about it. So yeah,
So I think, yeah,
that's how.
then you are Dr. Good Vibes wherever you go in that case.
Yes, I just like it's a very contagious. My laugh. Yes.
So, Vidya, where did you grow up? How was it growing up?
I grew up in, okay, so I'm a mixed, like I am a South Indian. My roots are from Kerala. I was born and brought up in Pune and I'm working in Delhi now. So it's like I'm a package full of India all together.
Wow.
And it's Pune is a lovely city. So I don't know if you've ever been there. It's a beautiful city with a very open and liberal people, and it's a very youth-oriented city. So I believe a lot of us who have been brought up in Pune have grown up with an open environment, and hence our
Hmm.
minds are also very open compared to different places that we grew up in. Like I do give Pune that. And there's a lot of colleges and universities there, so a lot of
Yeah.
people from all over India come there to study. And as a childhood, like I think my schooling was, I was a very sincere student in school. Yeah, I must say that. I was a very sincere student till 10th standard. Post 10th standard, yes, of course, when we become teenagers and our hormones take over us, that's when everything changed and I started exploring more of life. I started exploring everything outside the box. Because till school, I think we're all very protected and we're in this
Yes.
inside a box where we've been told what to do, what not to do, and it's our parents overlooking everything. But then once we come out and explore ourselves is when we, have a lot of realizations come to us. So that's just how about a lot of realizations came to me at that phase of my life. Yeah.
So now you're in Delhi, you said, right? And
Yes,
how do you like
yes.
the city?
It's great, except for the summers here. I cannot stand the summers here. Yes, Pune never had such bad summers.
Yeah. Yeah.
Although now it is having bad summers. Like I saw someone putting up a status saying it's like 39 to 40 degrees around there. So that's sad. Yeah.
Okay, so we already have questions coming in. I'll
Yes.
just start off with this very generic question, where
Sure.
what are the most common problems that people our age or you have witnessed people our age go through, and what would you suggest? How do they overcome that? So the most common problems which come through.
So yes, I'll tell you from my experience. From my experience, the most commonest I have seen is anxiety. One is social anxiety, and one is depression. Now, depression again depends. They'll come to me saying they have depression. Now that it's out, that this term is out there in the media and it's out there in the public, they come to me with the term saying that, oh, I have depression. I think I'm experiencing depression. Maybe you see, it takes a while. It takes at least 3 weeks to diagnose a depression. But yes, some of them do come with similar symptoms of depressions where they have suicidal thoughts and where they have been losing lack of interest in what they're doing. So I'm just telling you the symptoms of depression right now. So yeah, that's like few symptoms: lack of interest, not being able to sleep, losing appetite, all of this. That's one. And anxiety, yes, anxiety is, I don't think a lot of people are aware that they're anxious. They either come to me with saying that, I'm not really feeling great and I'm not being able to do something. Like one of my client came to me saying, before starting anything, I feel like I'm going to fail at it. So I don't start with anything. I don't have the courage to start with anything. And that itself is an anxiety that they have towards an exam or a project or anything, because there must have been some past events which has led to this, and now that acts as a trigger. Like suppose if someone had a failure in some kind of project in the past, and if they want to start a new project, now what when they approach this project, they go with a lot of fear towards it, and that triggers a lot of anxiety, and that's a normal response in our body, by the way. I want to make this clear that anxiety is a normal response of our body. There is good anxiety and there's bad anxiety. Now, the good anxiety is that in case we are in a dangerous situation, like if your house caught on fire, you need to run. Yes, so your body sets an
Correct.
alarm system. Your heart rate increases so that you're pumping enough oxygen and blood to rest of the body and your muscles to be able to run. So that's a normal response. Now imagine all the fears that we have in our minds. Like I just said, fear of failure, fear of rejection, and all of these fears. Now in life, when anyone is planning to face if there is any opportunity coming towards them, these fears, inhibit them from going ahead. Because what happens is this anxiety is triggered. Because according to the brain, they feel that they're in a dangerous situation and they start
Correct.
avoiding such situations. So like social anxiety is very common amongst nowadays. So people stop telling me that I'm not going to go out and I don't go see my friends nowadays. I don't feel like going and seeing them, and I don't talk to my friends the same I used to before, because there have been incidents, and now they feel that not facing this situation is a good thing. And the more
Mm-hmm.
they do it, the more it feels like the brain feels, oh, I'm avoiding it, and I'm not going through that rejection. I'm not going through the emotions when I'm feeling failure. So it's good. So the feedback they get while they avoid it is saying, oh, since I'm not going through those feelings that I used to feel for rejection and failure, I think this is a good thing. So I should
Mm-hmm.
start avoiding more. And that's when it becomes worse, because now the anxiety is going to get stronger and stronger and stronger, because the brain thinks this is good fear. This is a good
Correct.
anxiety, whereas it is not. So yeah, that's very common nowadays. Yeah.
Okay. So now, is it
Right.
okay to have a few off days? Let's say today I don't want to go out. I want to just curl up in the bed and sleep. But when do you know it's the onset of, let's say, the not good anxiety part of it?
Right.
When is it a good time to go and, let's say, talk to you, or who should we talk to when that happens?
All right. So, see, it's all right to sit at home and take a break. So, if you've, like, suppose if you've been working your ass off, and sorry for the words, but if you're working too much and you feel like you need to take a break
Mm-hmm.
at the end of this week, and you feel that you want to spend that time with yourself, and it's okay, you don't want to go out with friends, that's okay. But then when you realize that it's your best friend's birthday, imagine now it's your best
Mm-hmm.
friend's birthday and you want to go for it, but you don't go for it. You feel that no, there is something that's like there's a fear, there's a response in your body which makes you uncomfortable. And that is the
Mm-hmm.
reason you're avoiding such situations. That's when you need to notice that there is something which is disturbing me. And if there are situations where you feel that you are hampering your own quality of life, where you're hampering where there's something which is avoiding you from doing daily activities which you like doing, which you enjoy doing, and that's being harbored here, then you need to look into it. And also I want to tell you something, that's never too early to go to a therapist. It's never too early. If you are going through a time where it is difficult for you to handle it, a therapist is trained enough to tell you where it is coming from, how you need to deal with it, how you need to resolve it, and how you can deal with it better in the future. So it's never too
Mm-hmm.
early to ask for help, honestly. And I believe everyone needs therapy, because all of us have gone through some kind of trauma in our life since childhood,
Correct.
and it's all stored in our mind. Unless you have let go of it, it's all there in us. So yeah.
Correct. So also want to talk, now that you brought that up. Why is it such a taboo that if I go to a therapist, it's like you said, you'll be ostracized, or it'll reflect poorly on you. So
Right.
has this case been that people have taken a lot of time, the situation worsened, and then they came to you? Has there been cases like that?
Yes, of course. And that too, some of them have been because their family told them, their friends told them, and that's why when they came, like they come to me like, I've been going through this for a very long time, and one of my friends finally told me, I'm not going to help you anymore. You need to go and see a therapist. That's when they went to them. Because for a long time, what they do is like when it gets really tough, I believe you should go to a therapist. Yes, it is good to talk to your friends and family about it, but if it is not easy for you to deal with, and if it is you who's suffering, and if it is affecting, as I said, your
Mm-hmm.
quality of life, it is affecting how you think about things, and if it is affecting your self-image and the way you're treating yourself, you need to go and ask for help, and a therapist will easily do it. And also, another thing I want to say is a therapist it's an open space, it's a safe space, it's a non-judgmental space. When you talk to your
Mm-hmm.
best friend or your family, somewhere when you talk, you always think that what if they judge me? And that's why we
Mm-hmm.
never completely open up to our best friends or our family. We always hide a little bit of our feelings inside and don't completely let it out. But when you go to a therapist,
Mm-hmm.
it's an open space. You can let out all of that without being judged, and let it all free.
Yeah, and I think most of us have latent feelings which we don't even talk. I mean, which we don't talk about even to ourselves. Maybe I don't want to think
Absolutely.
about it.
Absolutely, because again, that's a good point. I'm glad you brought that up, because you know what? Since childhood, we've always been told to
Mm-hmm.
bottle things up. Like if
Correct.
suppose you felt bad and if you failed an exam and as a child, okay, like suppose you failed an exam and your father said or your mother said, oh my God, how could you fail an exam? And you're not good enough. And that's normal for parents, Indian parents specifically, to say these kind of things. And we
Mm-hmm.
feel really, and as a child, we are really, really hurt at that point of time because we don't expect
Mm-hmm.
that from parents. As a parent, sometimes they're not aware that they're hurting their children so much, but it hurts that child really badly. And that leaves
Mm-hmm.
a lot of impact on that child, because those emotions, now that memory that is saved inside that child's mind is with these emotions of guilt and shame and a lot of strong emotions such way. But what happens is he or she doesn't speak about it, thinking that, if I talk about it, my parents will yell at me more. And if I cry about it,
Mm-hmm.
I'm going to get yelled at, or I'm going to get beaten up by, or they'll be, make a fool out of me. Why is he crying? Because he failed. Oh, well, things like this. So it starts from
Mm-hmm.
very, very young. And then what he or she does is he suppresses that emotion and keeps it deep down inside. Now this pattern starts from there. So now when we grow up to become adults, we're used to this suppression of emotions. We really don't, we're
Correct.
used to not communicating how we really, really feel. We're used to bottling it all up and saying it's okay, we don't need to talk about it. We should just like keep it in as we always do, which is really
Correct.
not healthy because it's not really going outside of you. It's all bottling up inside of you and it's getting heavier and heavier. So that's where
So, Vidya,
communication comes in.
now that we're
Yes.
discussing anxiety, a few people have asked
Yes, I see the
questions,
question.
if I
Yeah,
can plug those in. So, Rachna
sure.
asked, so what if someone's not experienced failure but is still not confident to start something because they think they can do better? So, would self critiquing be a good
Right.
option, or when does she know that this is too much and that she has to seek help?
Right. So you talking about self-critiquing, right? That's a good
Yes.
point. So, Rachna, as you said, yes, it doesn't matter. I mean, it doesn't mean that only if you've experienced failure in the past that you don't won't fear some things in the future. We all have our own fears of uncertainty, fear of the future, and getting anxious about
Mm-hmm.
it. Now, self-critiquing is good to a certain level where it motivates you. All right.
Mm-hmm.
Now, if it is harboring you from doing things, if it is harboring you from taking actions, if it is harboring you from actually doing the things that you really want to do, then you should think about it and start minding your self talk. Because suppose if I want to start a project and I tell myself that I want to do this project, I want to build a restaurant, maybe. Okay, so I'm going to start a restaurant from this month. But then I start thinking to myself, no, I don't think I can do this. I doubt this, and I don't know if I will be able to manage this. But when you get to facts, when you actually think about how to do about these things and just put down those facts on paper and tell yourself, yes, I think I can do this, and see the reality of it and get to the facts of it.
Mm-hmm.
I think you can, but it's only the things in your mind that is stopping you. So when you realize that the self criticism is actually harboring your progress and it's not motivating you to do better, you need to look into it. And I would just advise you right now, even if you don't go to a therapist, I want to tell you that be kind to yourself. Anything we do in our lives, it is not easy for us to start anything new, any project,
Mm-hmm.
any progress in life. Life is very unpredictable. Anything can happen tomorrow. Like we didn't know about such a situation happening in our lives, right? A lockdown happening, never expected this. So anything can
Correct.
happen tomorrow. If we sit pondering over what may happen and don't really act upon the present, we are wasting away a lot of our precious energy just thinking about what may be, can be. So criticism is a good thing. I understand. Yes, it helps you it motivates you to do better. Yes, but criticism should not hamper your growth. Criticism should not make you stagnate in one place. And if it is stagnating you, I believe that's not criticism. That is being really harsh on yourself. That is being mean to yourself. That's what I say to my clients. I tell my clients, stop being mean to yourself. You don't want to treat yourself the same way that people treat you. And honestly, half of the times, actually not half, like I'd say most of the times, these thoughts of cannot do come from what we hear outside of us. Because we've heard that it's difficult, your parents told you it's not possible, your friend told you, oh, it's not that easy. And we fall into these thought processes of other people and lose our real emotions and thoughts to it. Because if you had wanted to do a project, it's because you knew you could. That's why it came into your mind, and you have the passion to do it, and that's the reason you started thinking about it. It's these thought process outside of you which is affecting you. So don't let that. Keep like a healthy boundary. That's what I do. I keep a healthy boundary outside of me, and I keep all these thought processes of other people outside this boundary. I do consider it, of course, because there might be some good advices there, but I keep my thought process clear, and I focus on that more. So yes, I hope that helps
So,
you.
so the other question is from Satakshi. So Satakshi asks, can lack of sleep or having trouble in sleeping be a symptom of anxiety?
Yes, it can be, but what else is she experiencing? Yes, lack of sleep, trouble in sleep can be a symptom of anxiety. As most of the time, the reasons we do not sleep and experience this is because we are overthinking over things. We are in this rut of thoughts that keep going on a loop again and again. And it's mostly a negative thought process, because if it was a happy one, we'll be like nicely sleep, going off to sleep. So, look into what you are going through. If there is something which is overwhelming you, if there are certain emotions which are clouding your mind, there are a few exercises that you can do. Like, you can start writing them down, because that's most of the times why people can't sleep, is because they don't understand what to do with these emotions that they're feeling, what to do with these thoughts that are clouding their mind. So one thing I get to tell my clients is to write them down. Write down your feelings. You can just take a piece of paper and ask yourself, how do I feel? And write down all the emotions in one go. Just write down all of them. And then ask yourself, what is the reason I feel this way? Maybe something might come up, maybe something might not. Whatever comes up, just write it down. After this, you can write down, what do you want to feel? Do you want to feel restless, frustrated, or annoyed, and anxious? And obviously, you wouldn't want to feel that. So write down what you want to feel. That is like happy, relaxed, calm, whatever, all the good feelings that you want to feel. Write that down. And the last question, what I do is, what would you do to feel this way? So then they'll ask them, you'll get an answer. Like, if someone asks me, what would you do to feel happy and relaxed? I'll be like, maybe take a hot shower, or maybe I'll go meditate, or maybe I'll put on some music and dance. So you know what you need to do to relax and calm down. So do that and write it down. And what happens when you write down these emotions and when you write down these answers is, you get much more clarity as to what is happening in your mind, what is troubling you. Because as of now, it's all a mumble jumble in your mind, and you don't understand what's happening. And that's the reason it's just like going in a rut again and again, and it's coming back to zero. When you get it down on paper, there's more clarity, because you're consciously getting that out on paper. So it helps a lot. Try doing that.
So is this a form of manifestation, would you say, Vidya? Is it more towards
Sorry.
the power of manifestation, that you write down what you want to feel and then you... Sorry, was
So
it clear here?
this is not a manifestation. So this manifestation is something as I would talk about it. This is actually recalibrating your thoughts. So when you write down your thoughts onto paper, and you write down, the last question is, what would you do to feel this way, that is happy, relaxed, and stuff. So you've written a plan of action now to feel happy and relaxed. You've written it down. So now you're sending a message back to your brain saying, ki, oh, I've written this, that I can do this to feel happy and relaxed. So now your brain knows what to do. So there is a new pathway, a positive pathway reinforced into your mind, because we've already given them hope. Ki, yes, this can change. We can feel relaxed and happy if we do this. So it's actually recalibration of your thoughts. It's rewiring your brain. So that's what we do in this process.
Sorry. Sorry for this. I want to read a question.
Yeah, no problem.
Anisha asks, Vidya, can you hear me?
Yes, I can hear you. How do you deal with social
Yeah.
anxiety? Okay. Right.
Yes.
So, yeah, great question. So I'm glad she brought that up. Now, for social anxiety, yes, it is difficult, and anxiety cannot be. So I never tell my clients to just go for it, okay? Because that scares the hell out of them, and if that turns out bad, it backfires. Because that fear that going out and to public and meeting people is not good. So what I suggest is an exposure hierarchy. So start with something small. Suppose in case you're not comfortable going out to a party with a lot of people and you get anxious in that, you can start with one tiny step at a time. All right. So the first step you can do is imagine yourself going to a party. Imagine the situations that can be around you and imagine what you would do in response and stay there. Stay there in your imagination for at least 5 to 10 minutes and see that your body, you might feel uncomfortable for a while. Stay with that uncomfortable feeling for a while. And when you overcome this after 5 to 10 minutes, when you survive this 5 to 10 minutes, your brain realizes, oh, okay, it's not that bad. I survived this for 5 to 10 minutes. So it sends a positive feedback, and that fear is reduced by 1% now. Not completely, but 1%. After that, next thing you can do is maybe talk to someone about going to a party. Because that itself brings a lot of anxiety in people. When people invite them, I've seen this. When people invite you to a party, they will just make up some lie and get some very uncomfortable and say, no, this, I've got this, I can't do this. It's just because they're not comfortable going to them and they're not comfortable saying that I feel uncomfortable coming to a party or going to a social gathering. So next step you can do is talk about going to a party. And when you start talking to it about it, maybe you don't go for that party. That's all right. But maybe you can just start, talk about it, tell your friends, yes, I might come to that party. And then again, imagine that whole process. Stay there, stay in that imagination process for 10, 15 minutes. If you survive that, again, another feedback is sent to your brain saying, oh, it's okay. I think that something is getting better here. I survived this. Because now we're sending the right feedback to your brain. And that is important. Because the more you avoid, the feedback which goes to your brain is, yes, avoiding this is a good thing. So we don't want that. That will be encouraging the fear, that will be strengthening this fear. And we don't want to strengthen the fear. We want to reduce this fear.
Correct.
Yes.
Correct.
So it's going to be one step at a time. So do that. Next thing you can do is, okay, go to a gathering of 2 people. Or maybe see a gathering of 2 people. Go till there and come back. Right? Go there, stay there for 5 minutes and come back. You survive 5 minutes. That's good enough for the start. Next thing you can do after that is, okay, next, two of your closest friends are gathering, 3 closest friends, nothing can happen. It's your closest friends. You can go to them. It's a safe space. Stay there for an hour. Try that for an hour. And then when you realize, it was not that bad. Okay, I can do this. Take one tiny step at a time, because this social anxieties have been built over time, and the thing is, it is not today that they've got the social anxiety. People who are
Correct.
experiencing the anxiety, it's not that they got it today. It's over time. They've been avoiding gatherings because it started somewhere and they've been avoiding, and that fear has now strengthened because of the feedback I just told you, what we said to give our brain. So we need to change that now. We need to rewire our brain and tell the brain, no, that's the wrong mechanism. That's just me strengthening my fear. I don't want to do that anymore. I'm going to face this fear. And that's the only way of dealing with anxiety. You need to face the fear, but one tiny step at a time. Because if tomorrow, if I tell you, a person who's suffering from social anxiety, if I tell that person, yeah, go to a party with 10 people tomorrow itself, won't be able to deal with it. He or she will have an abnormal response in their body. They will be uncomfortable and they will run away from there.
Correct.
And then they will come and tell me, no, I couldn't do it. I can't do this. So that's going to backfire, and then that's going to strengthen the fear. So then next time I tell them to do something, they won't do it. So it's always going to be one baby step at a time. And yes, it's called an exposure hierarchy. It's exposure to this fear very slowly, one tiny step at a time. You yourself can make this exposure. Whatever it is your fear, just like write it down one tiny step at a time, how you will face it. So yeah, till the big thing, of course. Yeah, I hope
So
that
now,
helps. Yeah.
Tanu has a question and she asks, is it
Right.
possible that diseases like Parkinson and dystonia may be caused due to stress? And do you think it is possible
Right.
to heal people suffering from such illnesses?
So, okay. So, Parkinsonism and dystonia, when you look at the science behind it, of course, it is a neurological disorder, and we connect neuromuscular disorders behind it. But let me tell you, I have seen stories and I have read books about where neuroplasticity is a term, and neuroscientists have been working on this, where they talk about finding a new neural pathway, right? So Parkinsonism and dystonia has been worked on for that. Parkinsonism, I don't think they have worked on Parkinsonism with just neuromuscular pathways or neurosciences, but worked on with that. Just by pathways can be formed, muscular activity can form pathways and better the dystonia. I mean, with time, of course. Yes, that can be done. That is the property of neuroplasticity that our brain has, and that is possible. It's just that it's not
Kanu,
very looked into. Yeah. Yes.
No, sorry.
Yes.
I'm sorry.
Yeah. It's not just that it's not very looked into in India, because most of the research that I did in neurosciences are outside of India, and I've read books where pain clinics work on the property of neuroplasticity, chronic pain patients where they've been living with the pain of spine injuries and really severe injuries, and that have relieved through this method. So there was a method of visualization one of the scientists did. So he used to make the patient visualize the spine as as it is normally, and and they did that visualization process till 6 to 7 months, and that pain was gone. That same scientist himself did it for his brain. So there's a region of the brain where the pain centers are, right? So the pain centers in a scan of a normal brain and a pain centers in the scan of his body. There was a difference there's a site atrophy, there's a change in it. So he saw this process, and he started visualizing a normal response to pain. So whenever he was experiencing a pain, he would visualize that part of his brain react in a normal scenario rather than in a painful scenario. And with time, that pain of is reduced. So that's again neuroplasticity of your brain, and that does work.
Okay. So Sharmili has a question, and she asks, so the extreme lows one experiences during PMS, is it only hormonal? And what if it lasts for, let's say, 3 days at a stretch? And is there a way to overcome this?
Yes. Okay. Yes, it does last for 3 days. For a few people, it does last for a day only or 2 days. It depends for each person. But let me tell you, it's different for each person. Each person has different experience, and the symptoms are different. I mean, like some people really experience very low depressive moods, and some people have an okayish. So, I mean, you cannot say that everyone has the same thing. But as you said, sorry, I didn't get the question was, is it only hormonal, right? Yes,
Is it only hormonal? Or how do you overcome this?
Yes, it is hormonal. But what happens is now what most people feel, since we know the thing as PMS exists, okay, and we know it's hormonal, a lot of people have thought this way into it, right? Because if you actually look at it, yes, of course, a hormonal change is going to happen to your body, but then your body is very intelligent, and your body knows this happens every month. And your body can actually take all of the changes that happens inside your body every month. But we've also experienced this sudden surge in our emotions, and when we experience the sudden surge in our emotions, we give it more importance. We actually go down that sinkhole, and then we keep thinking, my period 2 days ago, if sorry, I lost you, Pooja. Hello? You will have a sudden change in hormones in your body.
I think I lost you there.
Yes, I lost you too. But I don't know if our audience could hear us. I don't know what they missed. So, as I said, yes, it is hormonal, but our body is very intelligent to know these changes, and we can deal with it better by just looking at it as a small change in our body and not giving it so much of weightage. Yes, our body, if I tell my body, that, okay, my period is going to come in 5 days, and I'm going to start getting my PMS now. Now, what I'm sending the signal is that this is a really dreadful experience, and I hate this, and my body is going to go through hell now. So my mind is already sending the signal to my body. So you're going to have the worst PMS in your body now. But if I'm confident in my body, it's like, bindas attitude towards your body. You should have that kind of thing in your mind. It's
Correct.
like, my body will take care of it. I know my body is like very intelligent. I know my body is strong enough to handle this. I have this every month. I think by now my body should know how to handle this. And it does actually. Your body has a lot of intelligence that we're not aware of. So yes, don't think your way into it. And if you are experiencing it, take a break. It's okay. If you are experiencing a low, I would say take a break, relax, take a day off, and I would say do something that makes you feel good. Don't go down the drain, just lift yourself up. Do whatever you feel good doing, like dancing, eating a chocolate cake, watching a movie, whatever it is. Lift yourself up, reward yourself. Be like, oh, yes, I love my periods. have a cake. Right? So enjoy that time, anyways. Yeah.
So Anmol asks, what are simple ways to stay
Yes.
motivated in a situation like this?
Oh, simple ways. So, what I do is, okay, let me tell you first of all, the most important thing is I want you to focus on the positives. Like that's the most simplest thing you can do. There are a lot of positives that we can see. I think a lot of us will agree to it. We don't have to go to work. We don't have to travel to work. We are not going through that tedious metro or the locals that people take for traveling. So that is avoided. The environment has gotten much better. You're finally getting time to watch a lot of your Netflix series, I believe. You're finally getting time to, spend time with your family, your friends. A lot of things maybe that you've pushed off, you've got time for that, right? I mean, you can also do so much with the time that you have, learn a new instrument. That's one thing I would tell you to do is try something new. Because it can get monotonous sitting at home. So try
Correct.
something new. It can be cooking, it can be even like I think some people have started doing the TikTok videos, whatever suits your floats your boat. Like that. Anything new. Online courses are a good thing. You can try out online courses. Okay, I lost you again. I was audible? Yeah. So that's one of the positives. Try something new. Again, exercise and be in connection with nature. Connect with nature. Go to the terrace, spend some time in the balcony, get some sunlight, connect with your friends and family, get on video call with them, play games. There's a lot of things you can do. There's a lot of things outside of us which is cut off, but there's everything which is inside of us, that is our thoughts, our actions, and our emotions are in our control. So we can do a lot with that. So explore to that end. Explore what you like, your old hobbies maybe, go back to your childhood days and explore those times. Yeah.
Yeah, I think it's a good time to go play hopscotch, but alone.
Yeah, yes, absolutely. I painted after school recently. I literally
Wow.
took out a book and started painting. Yeah, I was so long back that I painted, and I was surprised myself. I was amused.
So were you any good?
Sorry, I missed you. Did you say
I
something?
said, were you were you any good when you painted after school?
In fact, I was much better. I was myself. I couldn't believe it. I was like, oh my God, I didn't know I was so good. I mean, according to what my standards were. Yeah, that was good.
So,
Yes.
Kushina with a lot of A's asks, is it okay to be lazy and not feel bad about it?
You should ask yourself that, Kushina. Well, okay, see, if your body wants a time for itself to take a break, all right? If you need a break from all that work, and if you need a break from all the mental and physical work, it's not just physical work, but mental work, and you
Correct.
think you deserve it, it's okay to be lazy then. It's okay to take that break. It's okay to enjoy that time relaxing and just not doing anything. It's absolutely fine because, we are always running after something or the other. We are always, it's always a chaos around us, but we do need a break sometimes. We need peace. We need relaxation. We need calm. And it's okay to
Correct.
be lazy and not feel bad about it. Yes, it's absolutely okay. And it's just that people give us guilt, ki aise, how can you just sit doing nothing? It's because bachpan se aise bola gaya, you can't sit doing nothing. That's not how it is. You can sit doing nothing and you can enjoy it as well. You cannot feel bad. about it as well, because you deserve it. You need that. The lockdown is that most of us, a lot of us have finally got that much needed break from the
Great.
chaotic life that we had. So it's great.
I'd say the same. So Abhi has a technical question here. He asks, what would be a better idea, medication or therapy? And then he asks,
Long-term,
what is the long-term
long,
use of
long-term use of it, especially with side effects. Okay,
sertraline?
side effects.
Cert
Yeah, sertraline.
yeah.
It's an sertraline inhibitor. All right. So medication versus therapy. So I'll tell you what.
Hmm.
Some of the diagnoses, like bipolar disorders and chronic mania disorders, like where there is a psychotic disorder involved, it would require a combination of medication and therapy. The therapy itself will not do, because until then,
Hmm.
what's happened is there's a lot of circuits, neural pathways which have formed, which have gone, let's say, haywire. Okay, and they are not making
Correct.
sense now. And even the person who's experiencing this is not aware of this. The person who's
Hmm.
experiencing this is having delusions, is having hallucinations, right? So when experiencing such kind of a disorder, medication is required, because there's very few times that people are not aware. I mean, if therapy is helpful when the person is aware of what that person is doing, when they understand what to do and what not to do. But in cases of such disorders, you cannot just use therapy. Medication is much needed. So medication. Whereas when it comes to anxiety, in some cases it can be dealt with. But if there have been cases where they've got to the have attempted or have such cases, you might need kind of some medication there. Yes. Long-term use of sertraline, especially with side effects.
Hmm.
Well, so long-term use of sertraline can lead to happens is resistance develops in a few patients, and what happens is it doesn't really do the job like with all other medications. Yes, and side effects are very much similar to what you're experiencing. That is excessive sleep and loss of appetite and acidity and all of these side effects. So yes, long-term use of any kind of medication, depending on what you're experiencing, is not good. I would advise, if you are taking any kind of medication, to always have a check with your psychiatrist if you need to change the medication, if you need to change the dosage, because after a certain time, that medication does not help either. Because the medication is just a
Hmm.
symptomatic relief. It's actually just a symptomatic relief. And as I said, after a point of time, your body, your mind is very intelligent. It understands that this is doing what it's doing. So that just acts as it more of like a toxic than what it needs to do. So yeah, that's
I
correct.
think today's session has been the longest till now, and I
Okay.
don't want to
Yeah.
stop. I don't want to stop already. So Prajalita has a question and she asks, what
Right.
would you advise to couples or people in any relationship who lack emotional intimacy?
Okay, that's a good question. So, let me talk about, first of all, the kind of people. Depending on the two people in the relationship as well, there are people, some of them who are, like you would say, introvert and extrovert, but I take them on an emotional scale. So for a person like me, I'm very out there, so I would speak my emotions out. Like what I feel, I will just, it will come out. And as you see, I obviously very blunt about it. But for some people, it's not very comfortable for them to speak their emotions. It's not very common for them to speak their emotions, and they expect
Hmm.
the other person to understand how they feel more through gestures. So try noting their gestures, try noting their bodily behavior, because the emotions always show in your bodily behavior.
Hmm.
It does show in your bodily behavior. So if you feel that the intimacy is lacking because they're not involved with each other, try out is communicate to each other. I don't know if the
Yeah,
audience here heard me. I
my
think the
internet
audience,
providers,
yeah.
yeah, I don't think so.
But I was just saying,
My internet provider is getting a hate mail today.
right. So I was saying, two people, are you still on?
Yeah, I am now.
Yeah, okay, great. So as I was saying, the two people who are in a relationship, as I said, if one is a extrovert and one is an introvert, and if the introvert is not actually expressing the emotions and not getting intimate emotionally, one thing you can do is communicate. You can always talk to that person and make them understand that I want you to be able to talk to me clearly, communicate to me clearly, so that it's easier to understand. Also, you can tell them, yes, we are two different individuals, so we both need to understand that we express differently. And even then, if that individual is not comfortable in talking, because as a normal scenario, most people are not comfortable talking about their emotions, so you can tell them to write about it. That's one thing I feel is very efficient, is if they don't want to talk about it, they can write about it, because some people are actually very comfortable in writing about it then talking about it. So when you talk about the relationship and the intimacy, first try communicating and sorting it out amongst yourself. And if it's not possible and if it's getting worse, then you should rather take help from someone else and get it sorted out. Yeah.
Uh, so again, I don't want to stop yet. So Palak asks, what is the most effective form of therapy available?
Sorry, I can't hear you.
So what's the most
Yeah.
effective form of therapy available right now? Palak asks this.
So, so first, most effective form of therapy, I would say, is the first one would be a cognitive, as in like a one-on-one talking therapy first, because that's when you finally actually express the emotion. So in my therapy, what I do is I talk to my client and I ask them what happened and I make them express those emotions. I want them to, because unless you get it out, it's going to be really heavy for you inside. Because this is not for me,
Correct.
the therapy is for you. And the very significant and most important thing about therapy is about finally letting go of those emotions. Move forward. Okay, I lost you again. Yeah. So yes, processing those emotions are important. Another modality of therapy which I have recently learned and practicing right now is hypnotherapy. Now, hypnotherapy, I mean, I know a lot of people have different concepts about it, but it's a beautiful, beautiful form of therapy because, so I don't know if a lot of people know, there's the conscious and the subconscious mind, right? So now the subconscious mind has all our memories, all our past events, and all the emotions with these past events stored in our subconscious mind. It has got all of it stored. Imagine like all of our childhoods, everything, all of it is stored in there. Now, all of us are made up of these memories and past events and the emotions and the experience that us, and we work with that state of mind. So a lot of us, when we talk about things and when we have, did I lose you?
No, 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 not really.
Yeah. Yes.
I can hear
So
you.
when we talk about things, sometimes we say, I don't know why I got so angry. I don't know why I lost my calm. I don't know why I reacted to a certain situation in a certain way. It's because, somewhere down the line, these events which happening in the, present have triggered something in the past. So in hypnotherapy, it actually helps us resolve these issues in the past by accessing through the subconscious mind. So it's resolved at the level of your subconscious mind, and it's phenomenal. So it's actually letting go of that, emotions take place at that time, reframing takes place, resolution takes place, and it's a phenomenal experience altogether. Yes, in India, not a lot of people know about this, not a lot of people practice it because of the taboo. They feel ki behosh kar denge, they'll do something else, and they have really different weird concepts about it. But I believe a lot of people should know about it more and be more aware about it. So yes.
Yeah, I think I have Bollywood to blame for this.
Yeah. There's Bollywood and there's a lot of YouTube videos of these fake gurus and fake hypnotherapists or whatever they call themselves. I don't know what they are. There are a lot of them who, come and they put on videos like where they just do something and then someone just like falls unconscious. I don't know what. Really creep shows out there. So yeah, that creeps a lot of people out. And that's the reason a
Definitely.
lot of people don't, yeah. That's why they don't look into these modalities.
Yeah, and
Yeah.
I think therapy is also underrated because of the way they show it in movies. Bollywood movie has
Yes,
undermined the
yes,
value of
yes.
therapy quite a bit, I would say. So people, whoever
Absolutely.
is watching us, do not go by it. Even the
Absolutely.
Yeah, even the operations they show in Bollywood movies is not what they usually do. So don't
Bollywood
go
has
what
spoiled
they
a
show
lot
in
for a
movies.
lot of us. I
Yes, at
agree with
least
you.
for doctors,
I
yes.
Yes, and I believe someone told someone came and recently told me, therapy is for the rich. That's what like Bollywood has, put it out there. It's because they show it
Exactly.
like that. Rather. And I'm like, no, no,
Exactly.
therapy is for everyone. It's not just for the rich. In fact, everyone needs therapy. Everyone needs to resolve all that kachra that they've stored in their mind for so long.
Exactly.
They need to.
Yeah, one round of cleaning is required every
It
year.
is.
The
It is
Diwali
required.
cleaning sorts, yes.
Yes.
So
Absolutely.
Kushina with a lot of A's has a follow-up question. She asks, I'm extremely dependent on my boyfriend emotionally. How do I know when it's toxic?
Oh, okay. Good question. That brings me back to self-love. Now, that's the topic I really want to talk about now. Yes. So you're dependent when you say, can I read that question? I'm extremely dependent on
Uh,
my boyfriend emotionally. How do I know when it's toxic? Now, Kushina, I want to tell you this, I'll start with a preface. So, like since childhood, we've always been, one second. Yeah, since childhood, we've always been told, take care of your Yeah, I lost you in between. Now you're back. Okay. So as I was saying, since childhood we've always been told to take care of our parents, take care of our brother, take care of our husband, take care of our wife, take care of our children, and we've never been told of to take care of ourselves. So what happens eventually is when as we grow older, we end up neglecting that one thing which is most important to us is that is ourselves. Because we've given all that we away to everyone around. We've given that love we want to our mom and family, boyfriend, girlfriend, everyone. We've given it all outside of us. Whereas the one place where it's most needed, where we need to actually give it all, we neglect to give every single time. Now the reason why, as she said, I'm emotionally dependent
mhm,
on my boyfriend. Now the reason why we depend on things outside of us is because we have a void inside of us. Void inside of us, which is waiting for our own love, which is waiting for our own acceptance, which is waiting for our attention to ourselves. And that void is empty. And to fill this void, we look everywhere outside of us. Whereas nothing outside of us can ever fill that void other than us ourselves. So if we finally love and accept ourselves and give ourselves all that attention and all that emotional attachment should be towards yourself. And when you
correct.
are content with yourself and give yourself with love and compassion that you deserve and you need, you will not be dependent on anyone. You will actually be independent because that love is coming from for you within you itself. It's all there around you. Like you're not an empty cup. And again, in a relationship, as I always tell everyone, you cannot pour from an empty cup. So if this is empty, you cannot give. So give that unconditional love towards you so that you can also give to others. And you will never have a dependency. You'll always have
Mhm,
a very well connected relationship, a very supporting relationship. It shouldn't be a
mhm,
dependency. Any relationship should not be a dependency. It should be
mhm.
connected, it should be supported. It should be like I say it should be like this rather than like this. That's what I tell. I'm like, this is like, they like cling on to each other, and then if one goes, the other one also goes down. But when it's like this, if one goes down, the other one can still lift this one up. So it's better to be like this, connected. That's better. Emotionally connected is how you should be, not dependent. Yeah,
So,
I think
yeah,
that's it.
Shashank has a question and he asks how to balance the energy if in a
Sorry.
relationship one person. Sorry,
I
Vidya,
think the
did I lose
volume
you?
reduced all of a sudden. Hold on. Oh, I think that's because my battery is low. So it's at 8% right now, so I think we can go with one more question though. Like one last
Sure. So,
question.
yeah, so how to balance the energy in a relationship if one person is very calm and the other one has too much energy?
Oh, that's a really good relationship though. So, see, honestly, when one person, imagine if one person is, both the people are calm, then how is there any energy in that relationship?